Epidemiology is the formal study of diseases and who gets them and why. And there's really two main ways that we can go about that. The first is that we can start with disease. And so a few years ago in Brazil, there was a large increase in the case of babies being born with microcephaly, or a very small head. And it took scientists a while to figure out this was due to a new virus called Zika virus. So we can start with that health outcome and then work backwards and find out what was the cause. Alternatively, we can start with an exposure, like a vaccine, for example, and we can ask the question, what happens to people who are given a vaccine? Are there any adverse health consequences as a result of being given that exposure? And epidemiology is really the formal study of those kinds of questions. Here on the MSc in Epidemiology at the school, we'll give you a very formal toolbox with how to investigate those kinds of questions. So we'll teach you both the key points of study design and all of the factors that go along with looking at data, getting the best from the data and knowing what the pitfalls are around those design points, and also the key statistical tools that you would need to be able to carry out those analyses in a really rigorous way. The focus at the school is very much on a practical application in how to do epidemiology so that you yourself can then carry out those formal studies in the future. What's unique about the programme are probably three main things. The first I would say is that the staff here at the school really are drawn from a very broad range of different expertise and different subject areas of epidemiology. So we run the range right through from mathematical modelling of infectious disease outbreaks through to things like cancer survival. So we've got very good expertise in both infectious diseases and also in non-communicable disease epidemiology. And you'll be taught by genuine international leaders in their fields. The other thing that's really unique about the programme here at the school is that the students themselves come from really diverse range of backgrounds, both geographically and also in terms of their past experience and their previous studies. For example, this year on the programme, we've got students from over 30 different individual countries, and that really diverse range and blend of students here at the school is one thing that the students, but also the staff, really appreciate. What are we looking for in terms of our applicants? Well, first of all, we're looking for people who've got a genuine passion for studying the determinants and causes of diseases and the impacts of exposures. Secondly, we're looking for students from a really broad range of disciplines. We have medics, people who've done life sciences, we do have people who've studied mathematics, but even if you've not taken one of those distinct kind of programs, if you've got relevant work experience and perhaps a slightly different background, then we're potentially also really keen to hear from you as well. And then finally, one thing that we can't avoid is that we do need all of our applicants to be comfortable with maths to some degree. So we ask that you've at least got a high school qualification in mathematics, but we do assume that you've not maybe touched it for a while, and we'll start from the very basics when we're teaching you here. So look forward to receiving your applications and to welcoming you to the school in September.